COVID, flu, and RSV, what's being called a tripledemic, are straining hospitals nationwide. So joining us now, Dr. Jayne Morgan, Executive Director of Health and Community Education at Piedmont Healthcare in Atlanta. Dr. Morgan, thank you for being with us.
Thank you.
As a doctor, would you feel comfortable traveling this holiday season?
Absolutely, Nichole. I think we need to understand how are we going to manage our lives, not only in this tridemic or tripledemic, but also within this surge. We're having certainly a resurgence of COVID. We've got to be able to utilize the tools that we have. Science has really been a marvel during this pandemic and has provided so many tools for us to use, from home testing to vaccinations to boosters to this bivalent booster to understanding what the public health measures are. So absolutely utilize the tools that you have and enjoy your holiday gatherings, but make sure you do it in as safe a manner as possible.
You know, and Doctor, you certainly know that it really wasn't that long ago. Experts were telling us not to travel for the holidays because of COVID. That's when the pandemic was really raging. Is this new tripledemic as serious of a threat, would you say?
And so certainly we are headed into a rough winter, shall we say, when we have all three of these viruses circulating at the same time. And I have particular concern for the elderly, those 65 and 70 years of age and older, because we see that the rates of hospitalization and death have certainly increased in that demographic. And yet only 35% have moved forward with receiving this bivalent booster. They are the most vulnerable and the most critical population that we need to move forward with being protected with this entire family of Omicron variants continuing to proliferate.
So Doctor, you touched on the elderly there. What would be your most important piece of advice to all people traveling for the holidays?
Everybody traveling, absolutely use your tools. Get boosted if you have not done so. One piece of information and data that maybe is not largely known is that those who are fully vaccinated, that definition by the CDC of having completed that primary series, now have just as high a rate of infection and hospitalization and death as those who are unvaccinated. Why is that? That is because those who completed the primary series have done so in a very remote fashion. That was a long time ago, more than 1 year, and those antibodies have waned. You have to get a booster to re-up those antibodies. And what we're seeing is those who are vaccinated by definition also are now having increased rates of hospitalization and death, on par with those who are unvaccinated, because those antibodies have disappeared.
All right. Dr. Morgan, thank you so much for your time and your advice. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.